So Christine is a clinician. You'll give us a brief, or you introduce yourself briefly before we go into this conversation.
I'm Christine Jogona Wambugu.
Mm-hmm.
I am a clinician
Yeah.
and a professional counselor.
Yeah.
I'm currently working
Just hold your mic close to you. Yeah.
currently working with United Nations volunteer
Mm-hmm.
as a COVID responder.
Oh wow.
So I'm
Uh-huh.
on the front line
Yeah.
fighting COVID
Mm-hmm.
and any other diseases
Yeah.
based at the Nairobi County.
So before we even talk about COVID, today all month we've been focusing on diabetes, the World Diabetes Awareness Month, yeah.
Yes.
And last week we had a nurse who came here to tell us about diabetes, what it's all about, how we should prevent ourselves from the disease, how we avoid the disease. But today we want to actually hear from you, people who are on the front line, so to speak. You're dealing with patients day to day, and you have first-hand experience of dealing with a diabetic patient. And of course, there are so many things that you look at us, living our lives out here carefree, and in your mind you just want to like, I wish these people knew what they are doing wrong. So maybe we can start this conversation from that point. What is it that you see us, people who are, so to speak, healthy, do, that you would want people to know that, my friend, doing this is leading you, this direction, and we don't want to you get in that going down that road.
Okay, thank you, Josephine. Actually, watched last week's show.
Thank
It was
you.
very interesting.
Mhm.
Nurse John did a good job.
Yeah.
And I've met a lot of young people,
Mhm.
this being a young people show,
Yeah.
who tell me that, Terry, I cannot have diabetes.
Yeah.
Diabetes is for the old. And I think even me when I was growing up, I used to know diabetes is for the old people. It's
Yeah.
for Guka, it's for Shosho.
True.
It's not for the youth. But I guess the reason why I'm here today
Mhm.
is to demystify that,
Yeah.
because diabetes is real, and especially among the youth.
Mhm.
And as you've said, I walk to a restaurant or I go to a party
Mhm.
and I see what people are eating, what people are drinking, and I'm like, God, do these people know what they're exposing themselves to?
Yeah.
Because diabetes is no longer a disease for the old people. It is a disease for everyone.
Mhm.
And these days, we even have young children who have diabetes.
Children.
So, yes,
Children as young as.
we have children as young as 1 year, 2 year old, 3 year old. But for them, we
Mhm.
cannot say it is their lifestyle.
Yeah, that's
Most of them inherit it from their parents.
so it can be inherited.
Yes, we have type 1 diabetes,
Mhm.
which you can inherit from your parents.
Okay.
And that one is very common in children
Mhm.
and teenagers. But for us youth, me and you, Josephine,
Yeah.
and those people who are watching us, you could not be having diabetes today.
Mhm.
But the lifestyle that you're living is exposing you to diabetes.
Yeah.
And maybe you are wondering, what lifestyle is this?
Yeah.
And we narrow down to diabetes. Tunajua ni ugonjwa wa
Sukari.
Kwa hivyo
Exactly.
kama ni ugonjwa wa sukari, we need to reduce our sugar intake.
Tukibaki tu hapo kwa ugonjwa wa sukari, I know a lot of people that my director over here, he takes a cup like this, yeah, amemimina sukari like 4 cups or 4 spoons, those big hips. I don't know whether that is what we are talking about when you say sugars.
That is part of the
Or
sugars.
part of it.
That sugar, the sugar we know, the
Mhm.
sukari for putting in tea,
Yeah.
is part of the sugars that we
Oh,
discussed.
okay. So it's not just the main thing that will cause you to
No,
have
there
diabetes.
is so much. There is so much.
Mhm.
We have those sugars.
Yeah.
We have the refined sugars.
Yeah.
We love crackers.
Okay.
We love refined foods.
What are refined foods?
We love sausages.
Okay.
We love burgers.
Mm.
We love bacon. I'm not trying to bring down Farmer's Choice or any other
Or
company.
like in a KFC.
Yes,
You're not
but you
mentioning,
see,
yeah.
the youth, we love overeating.
Mhm.
I want to do 5 sausages. And I know someone who does a lot of sausages.
Yeah.
I love your smile.
He might be
So-
watching.
I am very sure he's
Yeah.
watching this show.
Mhm.
Please, I am not mentioning names,
Yeah.
but we need to cut down on the fats, the refined fats, the saturated fats that we are eating in our diet.
Mhm.
I have met young people in the along the way,
Yeah.
and I tell them, when you eating ugali, how do you do your ugali? They like sukuma. They can't do these traditional vegetables.
Yeah.
They don't want to do anything considered traditional. But
Okay.
with diabetes, if we want to live for long,
Mhm.
we want to protect ourselves, we need to eat the traditional food.
Okay.
We need to work out. Do you know
Working
overweight
out.
is one of the causes of diabetes? Are you aware of that, Josephine?
Oh no, I didn't know actually.
Yes.
When
Being
somebody is overweight,
overweight, being obese is a predisposing factor for
Okay.
you to get diabetes. If you take too much alcohol,
Yeah.
it is also a factor that can take you to diabetes.
Mhm.
If you're like our director who loves too much
Sugar.
sugar in his tea or in your tea,
Yeah.
that is also another predisposing factor.
Mhm.
People who do not exercise,
Yeah.
we do not exercise. We want to eat everything that can be eaten, but we
That you
want
just want to
the
sit
gym.
down.
We don't want to
Exactly.
skip. We don't want to run. We
Mhm.
just want to sit down. That is another predisposing
Factor.
factor.
Okay.
And this is where the young people we need to arise
Mhm.
and fight diabetes, because you will be shocked.
Yeah.
In this, the people who are listening to me,
Mhm.
if we were to go to a hospital lab,
Yeah.
and do a test for sugar, it's called random blood sugar test.
Yeah.
You will be surprised that 50% of us would have a high blood sugar level.
Mhm.
Are you aware of that? But it does not mean you have diabetes.
Yeah.
If your blood sugar is high,
Yeah.
you could be having what is called pre-diabetes.
Okay.
And that part of being pre-diabetes, you can reverse by a lifestyle change.
Oh,
Yes.
okay. So if you have pre-diabetes, there's a way of reversing it,
Yes.
so that it doesn't manifest into the full disease.
Yes.
Okay.
You can reverse it through diet and exercise
No medication.
without medication.
Okay.
No, we only start you on medication,
Mhm.
and especially if there's a family history
Yeah.
of diabetes,
Yeah.
or if your sugars are too high and uncontrolled.
So at that point, you'll just be regulating the sugar levels.
Yes, we regulate the sugar levels.
Okay.
And for pre-diabetes, it is very easy for you to go back to no diabetes at all.
All right.
Yes, and I believe that is why you pull this show,
Yeah.
that we come and discuss,
Mhm.
because so many youths by there are living in ignorance.
Very true.
Then
very
have
true.
also met some other youths,
Mhm.
or even older people, and when you tell them their sugars are high, that they are diabetic, they are like, no, I am not going to start medication. You know what they say?
Yeah.
Unataka kuniambia nitakunywa dawa for life? Mimi sikunywi dawa for life.
Yeah, and then how then do you deal with that situation? There are patients who okay, amesema hivyo na amekataa kabisa. So how do you deal with a patient who has refused treatment, has refused medication, and you know full well, yani if he doesn't take hizi dawa, ni kubaya.
So for me, what I do,
Mhm.
the patients whom I meet and they are not willing to start medication,
Yeah.
I usually take them through the complications of diabetes. You see, yes.
It's kind of like reverse psychology.
Yes, I use reverse
Yeah.
psychology. I tell them, you have refused to take medication. Do you know diabetes can lead to loss of sight?
Blindness.
Yes. It's
Okay.
very easy for you to go blind with your sugar, especially for the diabetes that is not controlled.
Okay, guys, are you listening to this? This is serious. This is very
Yes,
serious. You can lose your sight.
You can lose your sight.
Yeah.
It predisposes you to cataract.
Mhm.
Cataract are some like growth in the eye that have to be surgically removed.
Oh wow.
Yes.
Uh-huh.
Diabetic and if it uncontrolled, it can lead to something we call nephropathy. Simple terms,
Mhm.
your nerve cells become damaged. You must have met, I am sure,
Mhm.
you must have met someone who tells you, nasikia kuganda miguu,
Yeah.
nasikia kuganda mikono,
Yeah.
and then hiyo kuganda inafika anashindwa hata kutembea. Diabetes can easily lead to that. Your nerves
wow.
become damaged.
Mhm.
Another side effect of, and I think this is what now makes most people decide to take medication.
Yeah.
If you're diabetic and your sugars are not controlled,
Mhm.
then you get injured. You get an injury.
Yeah.
An injury on your foot, on your hand, or you get a kidonda.
Yeah.
For that kidonda to pona, it takes a long time. And at times, you may have what is called a diabetic foot. Diabetic foot, it is a wound that does not get well.
You're
So are you
constantly
imagining?
unwell. It
Can you
doesn't
see
heal.
yourself limping the rest of your life just because
You
you
don't want to
refuse
take.
to take medication? And
Oh,
for
wow.
most people that I've told that, they're like, hey, daktari,
Mhm.
naweza anza dawa sahi. Unaweza itisha pharmacy dawa ikuje sahi nikunywe. And I think for me that works very well.
Yeah.
The other complication you can get
Mhm.
is you affect your kidneys.
Yeah.
Your kidneys become damaged just
Mhm.
because you have decided you
You-
don't want to take medication.
Yeah.
And this goes hand in hand with, we have people with high blood pressure
Okay.
who also at times get diabetes.
Yeah.
Then they refuse to take medication because medication is for life. And you find that their kidneys get damaged.
Affected.
So these people start going for dialysis because of something they could have prevented by
Mhm.
taking medication.
Yeah.
The other trick of diabetes is, even when you come Josephine and I start you
Yeah.
on diabetes medication,
Mhm.
I will still caution you on your diet.
Okay.
As long as you have
Diet
diabetes,
is very key.
diet is key.
Yeah.
Diet is key. Even if I put you on insulin, I give you 10 types of medication. If your diet is not managed, you will always come back to the hospital with very, very high sugars.
So diet is very key. Diet is key. We cannot emphasize this enough, guys.
Yeah.
Diet, diet, diet,
Diet is key.
Diet.
And something else for
Mhm.
the ladies who are listening and who are watching,
Yeah.
diabetes can make you have recurrent candidiasis, what
Okay.
most people call thrush.
Yeah.
If you find yourself every month, every week you're having thrush, please go to the nearest hospital, get yourself tested. It is one of the causes of recurrent candidiasis
Uh-huh.
and recurrent UTIs in women.
Oh wow.
Yes.
Okay.
Yes.
We did not know that. Maybe you can explain thrush in
layman's language.
layman's
Thrush
terms.
is,
We might both understand what it is, but we are
Yes.
talking to a wider audience.
Yes, so thrush is a fungal infection that affects our vaginas. And you have it by having vaginal discharge, which is whitish in color,
Yeah.
and you get very itchy that even when you're standing, you just feel you want to itch.
Mhm.
And I know for most ladies, what they do, when they feel the thrush, they go to the chemist
Or they
for
treat a
medication.
yeast infection
Yes,
instead.
they say, I have thrush, I have a yeast infection,
Mhm.
give me medication. But then you need to ask yourself, if this week, next week, the other week, you're being treated for thrush,
Mhm.
you need to get tested for diabetes.
Wow, who knew? Who knew? I personally am learning actually. I'm in class.
Yes.
I had no idea. We have some comments, questions. No, comments. Actually, I'm seeing comments. Beatrice is saying educative conversation. Or Chelsea, actually, she had commented about the cops. I love their vibe. Who knew the police could be this fun? Oh, thank you very much, Chelsea. Anyone who has any other comments, questions that you need to ask Christine regarding diabetes as well, we are ready to answer those questions. I mean, you have free consultation here.
Yes.
Kutoka kwa
By the way, I
daktari
am not
hapa.
charging consultation today.
All right. So you have told us about the complications and how you guys deal with patients who don't want to get or seek treatment. But I would like to understand. You're in the medical field. You deal with diabetes patients. How is that like for you? Like on a personal level, how is that like? How is that like?
On a personal level, at times I feel challenged, and I'm like, I don't like what my patients are going through. There are times I really get mad at the patients. I won't lie. There's because I've worked in different hospitals,
Yeah.
in different health facilities,
Mhm.
and sikosangi, every place ukosangi patient moja ama wawili hawakunywi dawa.
Yeah.
So every time there's a lady coming with sugars unreadable, 33 and above every other time.
Oh, before we
And
continue, how is it supposed to be? What level is it supposed to be?
it's
Sugar
not
level?
supposed to go beyond 7.
Oh wow.
It's not
Okay.
supposed to go beyond 7.
Uh-huh.
Then here I am. I
Mhm.
have a lady, every time she is coming to the clinic, her sugars are unreadable.
Yeah.
And I think it was 2 weeks ago, I got mad and I just told her, look here, you have to get serious.
This is
If
your
you're
life.
not going to take your medication,
Mhm.
I am going to refer you to another hospital. And she was like, no, daktari, unajua. Then you know what I realized?
Mhm.
This lady with diabetes
Yeah.
takes 2 Fanta sodas on daily basis. 2.
And I know one Fanta is equals to
Yes.
a
So
very
you
high
can
number of
imagine.
sugar.
Yes. And
Kawaida
even
sugar.
that time when I was with her, the soda was in her bag. And I felt like, I felt, I
Yeah.
wish I can check, you know. But
Because you know the
yes,
complications
I know
that come in, and
yes,
you're seeing that
yes,
she's going down that road.
yes.
Yeah.
So I had to take my time
Mhm.
and just make her understand that taking this soda is taking us back 100 steps.
Yeah.
And she's on insulin, meaning she injects herself insulin in the morning, she goes 10 steps. She
And then she
takes the
takes
first
soda.
Fanta 50 steps back.
I
The
know.
other Fanta, we go
Another
100 steps back.
Exactly.
And this is a caution even to you, Josephine.
Mhm.
This is a caution to everyone listening to us. Please let us take refined drinks in moderation. Let us take the sodas in moderation.
Mhm.
The artificial juices. People think if I'm taking Del Monte,
It's still fine.
I am
Yeah.
better than
Taking
the director who is taking Fanta. It is a lie.
Yeah.
Energy drinks that
Mhm.
we take,
Mhm.
all those we need to take. If we must take them, let us take them in moderation. I know of people who take 5 sodas in a day. And they're like, daktari, sina mafuta, mimi sijanona, kwa familia yetu hakuna diabetes.
Mhm.
Kwa nini unaniambia niachane na soda? Mnaweza kuwa kwa familia hakuna diabetes, lakini unaweza kuwa wewe ndio utakuwa wa kwanza because your lifestyle daily is exposing you to become diabetic. Yes.
Wow. Hey, I cannot imagine your life. Like every day you have to deal with,
Yes.
first it's sad. It's sad that you are actually seeing people finishing off themselves, like for lack of a better term. I also want to take you back to also dealing with patients. Because we are celebrating, we want to celebrate nurses, we want to celebrate people in the front line who are dealing with diabetes patients day in, day out. And, it must take a toll on you guys, yeah?
Yes.
How do you take care of yourself?
For me,
Yeah.
I'm a mother, I'm a wife, I'm a daughter, I'm an auntie. So how I'm able to take care of myself, I have trained myself to take my time out. I always take my time out.
Very necessary.
Yes. Even coming here today, my son was like, no, mami, leo ni Saturday, haufai kwenda job,
Yeah.
unaenda wapi?
Yeah.
Because I have trained my children, as long as it's a weekend, mommy is not working.
Yeah.
Mommy is home with her children.
Mhm.
And I also want to thank God I am blessed with a good husband. He's very supportive.
Yeah.
In fact, he's somewhere listening to the show.
Mhm.
Thank you very much.
Yeah.
So we have trained ourselves to have time for us and our family, so that by the time I'm hitting Monday, I am so refreshed. In fact, by the if you call me to consult me on a weekend, at times not unless because nakujua Josephine.
Yeah.
But mtu mwenye anani consult ka patient, I usually tell them please wait for Monday.
Yeah.
Or visit the nearest health facility. I just try to disassociate. When I'm at home, I am not a clinician.
Yeah.
I am a mother.
Yeah.
I am a wife. I am,
You're a friend, you're a sister, an auntie.
But
yes.
when I get to that hospital, immediately I enter that hospital gate,
Yeah.
everyone starts saying, hi daktari, sasa nakuwa daktari huko. When I go back home again, mimi siyo daktari.
Yeah.
Yes. And I also spiritual nourishment.
Yeah.
Because to have reference God
Yeah.
because He is above all.
Yeah.
I think at times when I get overwhelmed, at times when I have patients whom I feel, God, how do I deal with them? I also take time to pray and just tell God. But then my morning prayer daily is, God, give me energy and the strength
Yeah.
to handle the patients that will come my way today.
Yeah.
Yes.
And it must be draining because you're dealing. Actually, hospital is not a happy place.
Yes.
You know, there's so many sad emotions. You're dealing with patients who are unwell, and that energy also rubs off on you. So, yeah, you need that time off. It's very, very necessary. And nurses who, sorry. For nurses who don't have the time to, the people who work day and night, you get that you're working during the day, you only have rest at night, and early morning you're back at it. You don't have weekends. Most of them don't have weekends like as often as they would like. How do they, how within the hospital walls, the corridors and everything, how do they get to, stress relief at that particular, it's a lot you guys take in. It's so much.
For me, what I do, and in the places where I've worked, I am a fun loving person. So I always carry my fun with me, whichever facility I'm working in. So we always get time during breaks just to chat. Like yesterday, we were doing Jerusalem dance.
Yeah.
Out of the blues.
Mhm.
I was like, guys, we can just do Jerusalem kidogo.
Yeah, to let
And
loose.
yes,
a little.
so we where I've been, we always get time to have fun. If someone has a birthday, we get a cake, just to celebrate. And we also encourage each other to talk to each other. If you feel drained, if you feel you're fatigued, it's always important to talk to someone close. And especially during this time,
Yeah.
we have the normal patients, and we also have the fear of the COVID-19 pandemic.
Very true.
In fact, I think COVID now have made it even worse.
Yeah.
Because you come to work, I am afraid, will I get COVID and take it to my family?
Mhm.
Does any of my colleagues have, all that fear?
Yeah.
So, but recently we have gotten support where we get counselors to
Mhm.
come and just to debrief,
Yeah.
have conversations with us, and we've been getting moments to debrief.
Mhm.
And others, we just do it on our own. I know even you have called you a couple of times, and I'm
Yeah.
like, Josephine Nikubaya, I
I know.
feel like this.
Mhm.
So I always advise people, it's good to have a network. It's good to have a support network.
Mhm.
Those days when you're feeling down, those days when you're not sure if you're gonna make it tomorrow,
Yeah.
let your support network be there for you.
Yeah.
And for me, my biggest support network is my husband, my family,
family.
and I have girl squad who are always with me.
They're always
I
a
have
call
a
away.
good support network. Yes.
Yeah. It's very important. Very important.
Very
Even
crucial.
as
It's very key for you.
okay, let me see whether there are many other questions. Okay, as a frontline worker, Michael's asking, as a frontline worker, during COVID, what's your biggest fear, worry? You've mentioned one.
Yes. My
Contracting it.
biggest fear during this season is contracting COVID-19 and taking it home
To your baby.
to my babies, to
know.
my family. That is my biggest fear.
Yeah,
Yes.
must be heavy.
It is.
It must be heavy. I
Yes.
mean, you have the burden of taking care of other people. You have the burden of taking care of yourself, your colleagues. It's a lot. It's a lot. But you guys are doing an amazing job.
Thank
you
you.
are doing an amazing job. And
Thank you. Thank
that's
you.
why we're here, like to applaud you guys. I mean, we are just saying thank you for everything that you guys are doing on the front line. Brad is saying, loving the conversation. Thank you very much, Brad. Brad anasema bwana director, punguza sukari. Hey, I think tumemention sana huyu director wetu.
Director apunguza sukari.
Hey, director, nimekuletea free consultation, my friend. My salary should just go up, Ian is saying the show today is for VIPs. Police and doctors are represented. Yay!
Wow.
That's what's up. That's what's up.
Thank you.
Thank you so much, Ian. Keep those comments coming. Keep your questions coming. and tell us where you're watching the show from. We really love to hear from you. As I wind up this conversation, as you're in the front line, what can you tell us that that we haven't mentioned about our lifestyles, our diets, or any other thing that we need to be on the lookout? Matters concerning diabetes, and then now we'll go to matters concerning COVID.
Okay. What I would tell us is, if in your family, either your mother, your father, your brother or sister have confirmed diabetes, please, if you can be doing that random blood sugar check every 6 months, you can do it once in 6 months. It will keep you in check, because diabetes at times runs in families. So it's very important to keep checking your sugars. Then let us embrace a healthy lifestyle. Let us change our diet. Let us improve our diet. Let us exercise. And let us avoid over the counter medicine. Let's avoid going to the pharmacy, explaining to the pharmacist, I'm feeling like this. I feel you should give me this.
Yeah.
Let us avoid that, because you will find, diabetes makes you lose weight. I don't know if that has been mentioned. Diabetes causes a lot of weight loss.
Yeah.
So you can find someone going to the chemist, anasema hana appetite, ame lose weight, anapewa tu multivitamin. Anaambiwa appetite itarudi.
Yeah.
Anarudi tena after 2 weeks, anapewa multivitamin tena. Anaambiwa appetite itarudi. Well, in the real sense, it could be diabetes has already started eating him up. Okay. Let us avoid hiyo kwenda kujibaia madawa, ama unaenda unaambia daktari, mimi najua niko na hii. Let us learn to use the right channel.
Yeah.
Go to the hospital, explain yourself, have the correct tests done, and take medication that have been prescribed by a certified person.
Yeah.
Yes.
Not those quacks.
Not quacks.
And the chemist, ukienda chemist, those guys are not doctors, guys.
Yes.
So self-medication is really dangerous.
Yes.
Self-medicating yourself is very dangerous.
Yes. It's important then. Different types of diabetes, and also according to age, will help me determine which medication to put you on.
Okay.
So if you go and you started on the wrong medication, instead of getting better, you get worse. So it's very important. Come to the hospital. Let us put you on the right medication for your type of diabetes.
Okay. Yes. And I wouldn't be doing this conversation justice if we don't talk about COVID. You have dealt with COVID patients.
Yes.
How has that experience been, first and foremost? And what wrongs are you seeing us doing that could lead us to getting COVID?
Okay. Let me say, COVID is not a myth to start with. COVID is real. I have handled a lot of COVID-19 positive patients, not suspected. Positive. I have handled positive patients, and I feel sad when I am going out, and even Afande mentioned, tukimwona na uniform ndio tunakumbuka kuvaa mask.
Yeah.
In this current time, people are still thinking we are wearing masks for the police.
Yeah.
People are still thinking kutumia sanitizer ukishuka kwa matatu ama ukipanda matatu ni sure. And for me, by the way, I always take my time. Nikiingia kwa matatu nione driver, kama nimekaa next to the driver, I always tell the driver, please wear your mask, because haujui kama mimi niko na COVID.
Yeah.
In fact, we need to assume that everybody else has COVID apart from yourself.
Yeah.
Once you assume that, Josephine, ukimaliza na hii mic, you will sanitize.
Very true.
Ukimaliza job, utavaa mask. But ukiassume mimi sina, au wengine hawana, my friend, ndio utaipata.
Yeah.
We need to change our perceptions. I know people are getting what is called COVID fatigue. Watu wamechoka kuambiwa by mask. Wamechoka kuambiwa na mikono. Wamechoka kuambiwa wasiende club, wafanye social distance. Watu wamechoka. But at this time watu wanachoka ndio inazidi. Because just assume everybody has got COVID apart from yourself.
Yeah.
Guys, let us wear masks. Let us sanitize. Let us wash our hands. Let us observe the proper social distance.
Yeah. Before I let you go, final kabisa, hii ni ya mwisho by this sitauliza swali lingine.
Sawa.
How has that experience been for you? Being on the front line.
Being on the front line has been a challenge. I won't lie. There are times I became so paranoid. I would get home, napiga simu, naambia watu ni kukuja na kuja, make way, like sitaki kuguzana na watoto. I would come straight, kwanza niingie straight kwa bafu, mpaka naosha mpaka handbag, you know. I go take a shower, nafua hizo nguo. This time I was so paranoid until I realized this paranoia is gonna kill me. So what I do, immediately nafika, at least they know not to hug me first. I wash my hands, I change, I shower, then now we can. But I think the paranoia is kind of gone. But I'm still taking the precautions, and my babies will remind me, mami unatuambia tukuhug na hauja change, haujanawa mikono. And the scary bit is also like, what if I develop breathing complications? The ICU beds are full.
Especially that the
will
fact
they
that you know.
consider me that I am a health worker, but will that mean watoe mgonjwa mwingine ndio waniweke? There have always been all those questions at the back of my mind. And I know that has also been happening, especially for my colleagues in the public health facilities. I know that is a question at the back of most of their minds. Because NHIF was not covering COVID. Like ukipata COVID ni wewe ujipange.
Exactly.
Ni wewe ujipange. Okay, for me at least my employer understands, and they have put measures for the people working under the UN. But you see, that is just a very small.
Exactly.
It's a very
small percentage.
Fraction. The bigger percentage is what will happen. And I won't lie. Ata Monday nikiamkia job, I will still be Mwadhani. I am going to work. Do I have to?
You really have to. Exactly.
But we have to because I am called. For me, I say medical field is more of a calling. And if you do not have that calling, you will not be able to deal with your patients properly. For me, it's a calling. I love it, but in this COVID, I am ish, but I am still sojourning on.
Understandably so. We understand, and we celebrate you guys. We really, really celebrate you guys. You're doing an amazing job, exceptional, really, because waking up every day. Going out there, it's like cops in the battlefield. They go and they know, leo kanaweza nuka. And you don't know how the day is going to run. You don't know how the day is going to end. But you soldier on, no matter what. So we celebrate you.
Thank you.
We really celebrate you.
Thank you so much.
Thank you for the work that you're doing. But thank you so much for coming. We know we gave you a short notice, but thank you so much for coming to E Squared. And we are glad to have had this conversation.
Thank you. I'm also honored to have been here. And I hope to come back again and again. And I hope that the show continues and grows in leaps and bounds.
Thank you. Thank you so much for your blessings.